Welcome to COVID-19 Shelter Training for Partners. This training has been produced to aid American Red Cross partners in shelter operations during COVID-19. The coronavirus has caused Red Cross to change how shelters are managed, and these changes will be shared throughout the presentation. COVID-19 has not changed the Red Cross mission to alleviate human suffering in the face of emergencies, but it has changed how we shelter. Providing emergency assistance in a COVID-19 environment is new to everyone. Red Cross has a lot of experience in sheltering to draw from, and we have guidance from the CDC. We have put together our recommendations on how to plan for and operate disaster shelters in a COVID-19 environment. Next, we will talk about the intended audience for this training. This presentation has been designed with our partners in mind and is intended for organizations who provide support to those impacted by disasters. Working together, these groups support a whole community approach to provide sheltering and other services equitably to all individuals affected by a disaster. This training program provides Red Cross recommendations on sheltering in a COVID-19 environment. It does not cover how to respond to the pandemic. Instead, the training addresses shelter operations concurrent with the pandemic. Our procedures are based on guidance from the CDC. Safety for the workers and the shelter residents are at the forefront of every consideration. Many of you have some exposure to sheltering either through training or experience. If you are new to sheltering, we recommend basic training that is similar to what Red Cross shelter workers take. It's 3 classes, about 90 minutes in total, and all are now publicly available on YouTube. Course information and how to access these trainings will be provided in the resources section at the end. So if you're brand new to sheltering, take those 3 classes, then we welcome you to return to this training. In this COVID-19 sheltering training, we will provide you with an overview of what you need to do differently in sheltering in a COVID-19 environment. This training focuses on what is different in sheltering during COVID. We're building upon Red Cross sheltering principles, and our modified guidance is based on information from the CDC. Health, safety, and the well-being of your workers and the shelter residents, everyone involved with the shelter operation, should be top of mind for every decision you make. Safety is always the #1 priority. There's a new term on this slide, non-congregate shelter. This will be explained in further detail later in the presentation. For now, think of it as hotel sheltering, putting clients displaced by disaster into hotels. The point we want to make about non-congregate sheltering is that it is the preferred sheltering method. Try to put people in hotels or other types of non-congregate settings, such as campgrounds or dorms, as a first option. If a congregate shelter, the kind you see in a school gym, is established, you will want to have a lower occupancy so people can socially distance. That will translate to having a higher number of lower occupancy shelters that are smaller and more of them. At the bottom of some of the slides, you'll see a reference to resources. We can't give you all the information you will need in this short training, but we have links to resources that are publicly accessible. We put much of our Red Cross COVID guidance on the National Mass Care Strategy website, nationalmasscarestrategy.org. We have the URLs and info on how to access the resources at the end of this training. This entire presentation will be made available to you with live links. We will make it a searchable PDF and put it on that same website, National Mass Care Strategy. You can't see the URL on the slide, But all you need to do is click on the links in the PDF and you'll be taken where you need to go. Okay, we've given you some context about how we went about putting together our COVID-19 sheltering guidance and this training. Now let's go over what we'll cover today. We have divided this training into 3 sections. Preparing for the disaster. These are your pre-disaster or steady state activities. Operating the shelter. This is managing the facility, providing services to those needing help, maintaining supplies, things like that. Closing the facility. That's returning the facility to its pre-occupancy state, ensuring everyone has a place to go when they leave the shelter, ensuring workers are released or are provided with new assignments. We made some adjustments in our procedures in order to keep people safe. You may need to make your own adjustments, especially as CDC guidance is updated or upon the advice of local public health or emergency management officials. A Red Cross best practice is to consult with local public health and local emergency management before, during, and after shelter operations. Here's a reminder of the types of shelters. An evacuation center is where people go to get out of harm's way for a short period of time. It's that safe place you go before the hurricane makes landfall or when you're fleeing a wildfire. An evacuation center will generally not have all the amenities that you find in a traditional shelter. Depending on the type of threat, it may not have cots and blankets, for example. The modified methods of sheltering in a COVID environment also apply to evacuation centers. The best way to explain a non-congregate shelter is to give you examples. We're talking about hotels, motels, campsites, college dormitories, where there are physical barriers between people. This is the most desirable form of sheltering as the increased separation that the rooms provide helps reduce the possible spread of infection. A congregate shelter is where people come to receive food and shelter when a disaster happens. The most common form of congregate shelter is a school gym. If the only option is congregate sheltering, you will want to plan for having low occupancy shelters. When you keep your population low, like fewer than 50 people, you will need more shelters. You will need to plan for more space so people can maintain that 6 feet of social distancing. You'll also need more facilities. The shelters are smaller, so you'll need more of them. The American Red Cross is committed to supporting the needs of our communities in collaboration with our partners. It is important to meet with your local Red Cross and other partners in advance of disasters to discuss needs, expectations, capabilities, and capacity to assist. You'll want to discuss resource allocations so any gaps or shortfalls can be identified. Red Cross offers a variety of disaster trainings to its workforce and shares those resources with our partners at no charge to support well-trained workers and to let partners know what to expect from a Red Cross managed or supported shelter. Depending upon requests and arrangements, the Red Cross may be able to provide subject matter expertise, virtual support, material resources, and possibly human resources, people. Generally, a whole community approach and response creates a stronger bridge toward community resiliency and recovery. Now let's move on to some reasonable assumptions that can be made. There is always fear and anxiety among the shelter residents following a disaster. Expect more in this current environment. Shelter residents may be dealing with several stressful events, the first being the pandemic, and the second being the disaster that brought them into the shelter. Resources like people, supplies, PPE, things like that may be in short supply and take longer to get. Some staff members may not be able to work in a COVID environment. Partners you traditionally count on may not be available. Make sure you have contingency plans and workarounds for shortfalls, and definitely talk about them before the disaster happens. Hotels, campsites, college dorms, retreat camps are examples of non-congregate sheltering that have the physical barriers to provide space for social distancing. Non-congregate sheltering should always be the preferred option. Try to get your staffing footprint as small as possible. Consider combining roles in the shelter. You could combine the sheltering and the feeding roles into one. You could send one worker with dual expertise to the shelter instead of sending two people. The workers are stationed at the non-congregate site during the busiest hours, or they itinerate between sites, but typically not overnight. This graphic highlights strategies that can be implemented to minimize the potential spread of the virus. Efforts must be taken to minimize the spread of COVID-19. There's screening, access control, anyone over the age of 2 needs to be wearing a mask, increased sanitation activities, and social distancing throughout the shelter. There's the isolation care area. You'll have a smaller staffing footprint, and you'll try to limit the shelter population to fewer than 50 people. When combined, these strategies are especially helpful in mitigating the spread of this virus. Next, we will get into some specifics of how to get ready for a shelter operation during COVID. We have divided the shelter operations instruction into 3 parts. The first is preparing for the shelter operation. These are the tasks you will perform pre-disaster during steady state. Everything in this section will be performed before the disaster strikes. You need more shelter space. Before COVID-19, our guideline was 40 square feet per person, which includes the cot and a few personal items. During COVID-19, Red Cross is recommending 110 square feet per person to allow for social distancing, and the workers will need to social distance as well. In addressing your feeding plans, secure agreements with feeding vendors for 3 individually packaged meals per day for your residents and your workers, and anyone who is on site. Meal deliveries could be reduced to 1 or 2 times per day. In one of our recent operations, we were able to get breakfast, lunch, and dinner at the same time. Make sure you're following food safety at all times. Your meal plans could include cold meals, hot meals, snacks, and even shelf-stable items. When you're doing your planning with feeding vendors, find out if they can deliver in a COVID environment. That will help keep your in-person staffing numbers down. Now, with respect to pets, speak with your pet partners in advance about co-locating a pet shelter on the shelter grounds. Having the pet shelter in close proximity to the people shelter is best for the shelter resident. Pets should not go inside the shelter due to safety concerns. Unsolicited donations should not be accepted due to safety and health concerns during the COVID-19 pandemic. Have pre-scripted messaging on unsolicited donations in advance. Find out which donations organizations will accept donations and what their process entails, where the drop-off locations are, what items are allowed and not allowed. And then you can direct donors there when operations begin. If donations do come to your shelter, you should politely thank them for their generosity, explain the safety concern, and then direct them to an organization that is accepting donations. You could also put out signage that explains that donations are not being accepted. Many local organizations are facing a shortage of volunteers who can provide emergency assistance. You'll want to screen potential workers to find out if they are willing and able to respond in a COVID environment. Consider people who are good at solving problems and handling ambiguity and don't object to wearing a mask. The Red Cross always has at least 2 people working in person at every shift in a congregate shelter. You can also recruit shelter residents. We do that in a non-COVID environment too. The point is to minimize your staffing footprint. Any job that can be done virtually should be done virtually. Another important consideration is what supplies you will need to support your shelter. Standard supplies like cots and blankets are more obvious. This slide provides direction on additional supplies that will augment your standard list. You'll follow the guidance from your local public health on exact usage, such as who needs these supplies and in what circumstances, and how often to change the masks, for example. Now that we've covered supplies, let's move into shelter setup considerations. Now we're in the next phase of operating a shelter. You've had your conversations with other organizations about facilities, feeding, pets, donations. You've pre-screened your workers so you have a general idea of their availability. Disaster strikes. Now you need to operate a congregate shelter. You'll immediately consult with local emergency management, public health, and other partners to coordinate response efforts and avoid duplication of services. There's a lot to consider when planning and setting up your shelter site. An opening inspection of the facility is recommended to document any pre-existing damage. Consider where each area will be set up and ensure there are no safety issues for the shelter residents or the workers. The health screening area should be set up outside of the facility with social distancing protocols in place. Of course, families can be kept together as a group. An isolation care area staffed by licensed healthcare professionals should be identified and set up prior to the shelter site opening. In the event that anyone screened is symptomatic, you'll need a place to direct them to. This is why you need to set up the isolation care area before your shelter opens. In addition to having hand sanitizer, hand washing stations should be acquired and placed strategically throughout the shelter site. You can put them in the isolation care area, feeding area, dormitory, and outside the screening area. Those are all great places to set up extra hand washing stations. Keep the feeding area separate from the dormitory. It provides an additional measure of health safety for the shelter residents. When planning the flow of your shelter site, create one-way entrances and exits for access and deliveries. It helps prevent people from passing by each other too closely. Another consideration is the storage of shelter residents' personal belongings. Plastic storage boxes are easy to store and keep clean with sanitizing wipes or spray cleaner and paper towels. Social distancing and hand hygiene start when setting up your shelters. Remember to wash your hands between setup activities. As shelter residents are being screened at the entry, ensure social distancing measures are implemented by maintaining 6 feet between workers and incoming residents, between everyone. It's fine to let families stay closer than 6 feet. Continue to practice these measures throughout the shelter by posting signage with safety protocols. Increase the frequency of cleaning and sanitizing. Keep hand washing stations stocked with soap and paper towels. Provide extra trash bins that are emptied frequently, and wipe down countertops, tables, and other surfaces every 2 hours. Here we will show you a graphic of a recommended site setup if the decision has been made to proceed with opening a congregate shelter. Remember, congregate sheltering is used as a last resort. As shelter residents arrive, direct them to the screening area. Once they're screened, shelter residents who are symptomatic or suspected of being COVID-19 positive can be directed to the isolation care area for further evaluation by a licensed healthcare professional or local public health staff. Direct those who are asymptomatic to the shelter registration area for entry into the shelter. If a shelter resident becomes symptomatic or suspected COVID positive at any time during the shelter operation, send the resident to the isolation care area for evaluation. Allow 110 square feet per person. Lower population counts are safer in this environment, and the 110 square feet per person will help support that. For example, about 5,500 square feet of dormitory space is needed to accommodate about 50 shelter residents. There may be circumstances where the authorities may want you to open a shelter with more than 50 people. This decision should be made in cooperation with local public health. As previously mentioned, have the screening, dormitory, and isolation care areas set up so that they are truly separate areas in advance of opening. A separate entrance and exit should be considered for deliveries. Moving into more details on the setup, the screening area should be under some type of awning or canopy to protect people from weather and should be immediately outside of the shelter. Use markers such as cones or tape to indicate 6 feet of separation. And be sure your supplies, hand washing stations, hand sanitizer, and trash cans are accessible to everyone. Everyone entering the facility should be screened, including workers, shelter residents, and visitors. As people arrive at the screening area, trained screeners ask screening questions, take the temperature, and direct the individual to either the isolation care registration area or the shelter registration area. In the next slide, we'll present setting up the isolation care area. When considering where to set up the isolation care area, bear in mind that this area should have its own bathrooms, showers, and hand washing stations. Make sure some of them are ADA compliant. Access to this area should be limited to health professionals wearing appropriate PPE and shelter residents who are suspected of being COVID positive or are symptomatic for any illness. As in the dormitory, cots are placed 6 feet apart, set up head to toe, ideally with some sort of privacy screen in between them. Allow space for health workers to adequately don and doff PPE and to dispose of it in a designated receptacle. Have conversations with public health to discuss what you will do if a symptomatic resident will not remain in the isolation care area. And remember, only public health agencies have the legal authority to quarantine or isolate people. The current graphic provides an example of how an isolation care area might be set up. The entrance area clearly indicates restricted access. Health professionals will need an area outside the isolation care area for putting on and taking off PPE. Within the resident area, cots have been placed 6 feet apart with privacy screens to separate each area. Alternating the head-to-toe setup of each cot allows for additional distancing between residents. Let's move on to the reception and registration areas. Individuals coming through registration have been screened. They're wearing masks and they're staying 6 feet apart from each other and from the workers. Remember, families may be within 6 feet of each other. Use blue tape or cones to mark off 6 feet. Set up pen cups with multiple pens, one cup for clean pens and another for used pens. Used pens can be wiped down with a sanitizing cloth and reused. Make sure you take appropriate measures to maintain people's privacy, especially with the social distancing. Keep registration tables separated and consider using privacy screens. During the registration process, be patient. Look people in the eye. Be compassionate and give each person the time needed to complete the registration process. Take your time. Get translation help if needed. Provide shelter residents with the shelter rules, feeding times, and tell them how to get more information. In addition to collecting family information during the registration process, you're also creating a dialogue and getting an understanding of unmet needs. Does each family member have what they need to be comfortable, such as their eyeglasses and their prescriptions? Are they in emotional distress? You can refer them to a licensed health professional for assistance. Conduct the midnight or overnight count as usual. Count anyone who sleeps in the dormitory at the shelter, including night shift workers. They don't have to be physically present at the time of the count. Your local emergency management may require more frequent counts. Before opening your shelter, remember to consider signage. Signage is important well before entering the shelter site. Beginning outside the shelter, before registration, it's important to have directional signage so people know where to go. Once inside, it's good to have signage reminding residents of shelter rules, including those specific to COVID-19. The CDC has some nice signage you can print, and we included a link to it. We recommend you put out signs for social distancing, face coverings, no pets, and no unsolicited donations. Consider the languages spoken in your community and provide signage. Remember to think about how you will communicate rules and information with people with disabilities and access and functional needs. After registration, residents will proceed to the dormitory. The dormitory layout requires careful consideration, specifically the placement of the cots. To support social distancing, have your shelter residents alternate head and toe from cot to cot. That way you won't have two shelter residents with their heads next to each other. Parents may want to have children closer than 6 feet, which is fine. One entry and one exit to reduce the number of people you need to staff those areas is recommended. With the virus, one-way traffic is also safer. Use blue tape to mark arrows on the floor. Do not block any emergency exits. These must remain accessible in the event of an emergency. Place a hand washing station at the entrance to the dormitory and place hand sanitizer throughout. Two important COVID-19 dormitory modifications are shown on this slide. In order to keep residents and staff safe during COVID-19, cots must be 6 feet apart on all sides. Each resident will occupy a 110 square foot area. The amount of space will accommodate people with service animals or medical equipment. Allow families to move their cots closer together. Now let's look at the feeding area and how it's modified during this pandemic. Social distancing needs to be maintained in the feeding area. If you don't have room to maintain the 6 feet, you could set up a serving tent outside or a dining hall tent. The feeding area needs to be separate from the dormitory. Consider staggered feeding times. Space tables 6 feet apart and hand washing stations. Supply hand sanitizer. And if possible, provide barriers between servers and residents. Provide appropriate PPE for your servers. Food will be packaged and served differently during the pandemic. Another consideration with feeding is to provide individually packaged meals. You might hear people call them IPMs. Rather than serving out of containers, you'll want to provide individually packaged meals as a safer alternative to buffet lines or feeding from bulk containers. It's a good idea to identify vendors who can provide packaged meals before the sheltering begins. All workers need to follow safe food handling guidelines to reduce disease transmission. Use the set it down and step back method of serving. Clean and disinfect every 2 hours and before and after every meal. These methods are illustrated on the next slide. Before we discuss the set it down and step back method, notice that this particular graphic provides an idea on how you might want to set up your feeding. Your feeding workers will need appropriate PPE. The set it down and step back method is exactly what you think it is. Asking the resident what type of meal they would like from a 6-foot distance, then setting the meal on the table and stepping back to allow 6 feet of space so the shelter resident can move forward to pick up the meal. Again, the worker sets one individually packaged meal out at a time. Then they step back. The resident comes forward and takes the meal. If a resident touches a food item, it's theirs. The feeding worker wipes down the surface, then greets the next person to receive their meal. Be sure considerations have been made to support those who have disabilities, access, or functional needs in getting their meals. A worker may need to bring the meal to a table for someone who cannot carry these items. This brings us to considerations of inclusivity and accessibility. Everyone is welcome in a shelter that Red Cross manages or supports. This goes beyond just letting people in who need a place to stay. Be deliberate about ensuring everyone has access to all information and services available in the shelter. People will be anxious and will want information. You'll need to provide signage and information translated and available in your community's most commonly used languages. Think about unique dietary needs for health and religious reasons. For those with assistive equipment that requires power, put their cots near the outlets. Think about who needs to be closest to the restrooms. Try to provide at least one restroom that can be designated as a gender-neutral family restroom. The best way to know how to help a client is to ask them. They're the subject matter experts on meeting their needs and maintaining their independence. Children and service animals also need consideration. Children need activity to grow and learn. Setting up a children's play area, however, is not recommended in this environment. You can offer children toys and books as long as they're not shared. Service animals are always welcome in shelters. Next, we'll talk about ways to interact in the shelter with residents. Now let's talk about interacting with shelter residents. It serves several purposes. It shows you care, and it allows you to listen for unmet needs. Interacting with clients will come naturally to some of you. Others can learn by watching those it comes naturally to. There's a complicating factor with the 6 feet of social distancing while also maintaining privacy. To start the conversation, you could ask, "Is there anything I can help you with right now?" When we add the right now, it's not so overwhelming to the resident. Or you might consider joining the resident for lunch while maintaining 6 feet of separation. It might take a couple of days for the resident to open up. With time, you will get the answers you need to help residents transition out of the shelter. Let's consider that transition. When you interact with residents, you will begin to understand why they are unable to leave the shelter. Residents may have lost everything. They will need your assistance to help them move forward. You'll want to start working on an individual recovery plan for each person in the shelter right away. How is this done? Staff members need to make sure they are providing information to residents about updates on the disaster and agencies available to help them, like FEMA, Social Security, and others. Once unmet needs are understood, work to find community partners to provide necessary services. Eventually, with a whole community approach, solutions are found, and it's time to close the shelter. Closing may be the last phase of the shelter operation, but it's something you start planning for well in advance. When residents are able to move from the shelter to more sustainable housing, it's time to close the shelter. The most important point here is to make sure every resident has a plan to go somewhere safe before the shelter closes. Identifying possible community partners to be part of this process is something you should do pre-disaster, so you have an understanding of your partner's capabilities and capacity. Transportation to new housing is frequently an issue. Give residents and key stakeholders at least 48 hours notice of the closure. Let them know when the last meal will be served. Do your closing inspection. You'll want to compare that inspection with the opening inspection. And finally, arrange for a thorough cleaning. We strive to leave the facility at least as nice as we found it, so we get invited back. Before we conclude the presentation, let's review the key takeaways and summarize what we've covered. Safety should be at the forefront of everything you do. Safety of the workers and safety of the shelter residents, as well as the safety of our partners working alongside us. Conduct shelter operations with guidance from local public health officials and emergency management. Stay current on public health guidelines for staying safe. Make sure you have enough shelter space. With 110 square feet per person, you will need more shelter space than pre-COVID. Use barriers, privacy screens, blue tape, and cones to help cue people on appropriate social distancing. Having just reviewed the key takeaways, let's go over the summary. The next 3 slides summarize the key points presented during this training. A printable document of these highlights has been created for use as a reference tool. There is a link to it in an upcoming slide. When non-congregate sheltering is not a viable option, remember, facilities will house fewer people because the guideline is now 110 square feet per cot. Staffing may be difficult due to worker availability and restrictions for working in this environment. Staffing footprints should be limited to lessen potential contact. Keep in mind, some staff can perform work virtually, and shelter residents can be asked to support tasks within the shelter. Health safety is paramount. Conduct screenings of all shelter residents and do daily check-ins. Provide additional hand washing stations, hand sanitizer, and PPE. increase cleaning and sanitizing, and maintain social distancing standards. Continuing on with our summary, everyone gets screened prior to being registered. Isolation care areas are set up prior to opening and should be staffed by licensed health professionals. In the registration area, be mindful of social distancing while finding a way to maintain privacy. Consider using privacy screens. Arrange the cots so the residents are alternating head to toe. Feed people using individually packaged meals. Increase the amount of cleaning. Set up co-located pet shelters on the shelter grounds. We recommend unsolicited donations not be accepted due to safety concerns. This is a screenshot of the National Mass Care Strategy website. It is publicly available and you don't need a login. The URL is there at the bottom. The materials you will see on the next few slides have been posted on this website or are available on other public websites. We have provided the links for you. This training is also posted as a PDF. You can find it in the COVID-19 Resources drop-down menu there on the screen. Displayed on this slide are the resources that were referenced throughout this presentation. Again, you can find them on the National Mass Care Strategy website in the COVID-19 Resources section. Much of the Red Cross content is in the compendium. It's the second item on this screen. Here are more resources for you. There are links behind all of these. For partners who do not have any shelter training or experience, we recommend 3 Red Cross classes available on YouTube. It's publicly available and you don't need a login. They're the same classes that Red Cross workers take: Shelter Fundamentals, Sheltering in a COVID-19 Environment, and COVID-19 Shelter Assignments. If you have questions or suggestions, please reach out to us at masscare@redcross.org. American Red Cross thanks you for your attention.